make you laugh.
Please don't.
Okay, yeah, I'm gonna be good.
Alright.
I'm gonna be good.
In the last few months, we've heard about cases about staph infection and MRSA. Some of them have proven to be more severe than others, but we don't really know what it is, or how to prevent it, or how we get it. So today I'd like to talk to you about MRSA and about what causes it, what the symptoms are, some treatments, and most importantly, how to prevent it within your own lives. Let's first talk about what MRSA actually is and the definition. The Center for Disease Control and Prevention defines MRSA as methicillin-resistant Staphylococcus aureus. It is a type of bacteria that is resistant to most antibiotics. There are two types of MRSA: healthcare-associated MRSA and community-associated MRSA. Healthcare-associated MRSA is found in hospitals and nursing homes, different healthcare facilities like that. Most people that get this bacteria are people with weakened immune systems or those that have been recently hospitalized and had surgery. The community-associated MRSA is found in athletic facilities, especially on artificial turf for football, football fields. It's also found in gymnasiums and fitness centers as well as your own homes. Most people that get that are athletes who play contact sports, or football players that play on artificial turf. You can also acquire it from just working out at a fitness center and not knowing the proper precautions to take before you get on a piece of equipment. Now that we know the two most common types of MRSA, I would like to talk to you about some symptoms and some tests that can be done to determine it. Most commonly, MRSA looks like a spider bite, a red area on your skin that can be tender to the touch. It also can look like a pimple. It may have drainage. You could have a fever, some warmth around the area, or a boil or an abscess on the skin. More serious cases would include things such as a rash, body and muscle aches, fever, headaches, chills, shortness of breath, chest pain, and fatigue. Some simple tests can be done to determine MRSA. Drainage cultures, blood cultures, tissue samples, and nasal secretions all are tests that can be done to determine MRSA. There are many symptoms to consider when determining MRSA, as well as tests that can be done by your doctor. But what about the causes, and how can it be treated? I bet you didn't know that most of us are carriers of MRSA. According to the Center for Disease Control and Prevention, 25 to 30% of people are carriers of MRSA or are colonized. This means that the bacteria is present on your body, but it is not infectious. It is transmitted through several ways. Skin-to-skin contact is the most common. An athlete may have a MRSA spot on his or her body, not knowing it, and it could be draining, and without the proper coverage in a contact sport, he may come in contact with another player, giving them the infection as well. It can also be transmitted through sharing personal items, such as razors and towels and different things that you use at home. It also is transmitted through surgery in a hospital. The treatment is determined by the severity of the infection. The most important thing to do is see your doctor immediately. If you are concerned about a spot, go to your doctor and ask him to test it. Once they determine that it is MRSA, most likely they will drain the spot and give you antibiotics through the pill that you will take for up to 2 weeks to get rid of that infection. Central Baptist notes that the following are proven successful in treating MRSA infections: clindamycin, linezolid, tetracycline, Bactrim, and vancomycin. A more serious infection may require IV antibiotics or oxygen or kidney dialysis. When they do the IV antibiotics, most of the time they will put you in the hospital for that period of time to monitor all of your different blood counts and different things like that to make sure that your kidneys aren't failing or other organs aren't being affected. MRSA can prove to be a dangerous strain of bacteria if not treated properly by both the individual and the doctor. Now let's look at some precautions that you can take at home to help decrease the spread of this bacteria. The Mayo Clinic has identified a few things that we do on a daily basis to prevent spreading of MRSA. Washing your hands with warm water for 15 to 30 seconds with liquid soap rather than a bar soap. And when you dry your hands, rather than drying them with a towel, use a paper towel that can be thrown away. Don't show your personal items. Always cover your wounds until they are completely healed. It's easy to, put a Band-Aid on a scratch, and then once it scabs over, we don't worry with it anymore. It's scabbed over. But it's always, they suggest that we keep it completely covered until it is completely healed. Always wash your towels and linens in hot water with bleach if possible. When you're disinfecting and cleaning your house, make sure you pay careful attention to your bathroom and kitchen, because that is where the bacteria stays the most. And always read the directions on the back of the bottle. Disinfecting, if it's got a disinfectant in it, they suggest that you spray the area and leave it sit for 1 minute and then go back and wipe it so that the disinfectant has time to do its job. You could also use a tablespoon of bleach to a quart of water to clean with, but you need to do that every day if you're going to use that as a method of cleaning. Always follow directions given by your doctor for both treatment and things to do around your home to get rid of the bacteria that could be sitting on your surfaces. And most importantly, see a doctor if you have a concern and ask them to test it for MRSA. MRSA is a serious bacteria that can cause any of us at any given time, but with the knowledge given today, we can hopefully protect ourselves and prevent some of the risk for the spread of MRSA. Today I have given you some information in regard to MRSA.